Welcome to the deep dive. We take your sources, your data, your research, and we boil it all down into the essential insights, the stuff you really need to know. Our mission. Simple. Cut through the noise, give you clarity. Turn those numbers into understanding. Today, we're diving into something pretty critical, actually. It's the global H7N9 Vaccines Market. Our source material for this is, it's excerpts from a big market report, the Global Edition 2025. It gives us data for 2021, projects out to 2025, and even looks ahead to 2033. So we get a good view of growth, where it's happening, and where it's heading. And H7N9, just for context, is that avian flu strain, the one with pandemic potential. So vaccine readiness here is, it's vital.
Absolutely vital. And this deep dive, it isn't just about dollars and cents or market share. It's really a window into how we're preparing globally for potential health threats. Understanding this specific market tells you a lot about shifting priorities, investment flows, and how different places are building resilience. You're going to see how these figures really connect to, our collective health security.
Okay, let's unpack that global snapshot first, because the overall growth numbers are pretty eye-opening. Back in 2021, the market was valued at, just under $1.3 billion, so $12,296.33 million to be exact. But the projection, it's expected to hit almost $1.7 billion by 2025.
Right, $1,676.6 million.
And then looking further out to 2033, it's forecast to reach $2.8 billion. That's $2,804.5 million.
That's quite a jump.
Really is.
Yeah.
It works out to a compound annual growth rate, the CAGR, of about 6.6%, which for a specific vaccine market, that feels like pretty strong, sustained growth.
Yeah, what's genuinely striking there isn't just the final number, but that consistent climb for such a targeted vaccine. A robust growth rate, like 6.6%, signals more than just market demand. It really reflects how global healthcare systems are evolving. They're putting more emphasis on pandemic preparedness. We're seeing stronger regulations, more dedicated international programs pushing vaccine development and access. So yeah, it's not just numbers, it's evidence of a tangible global response taking shape.
Okay, so that's the big picture. But here's where it gets really interesting, I think. Let's dive into the regional hotspots. Because some areas are just showing incredible momentum. Asia-Pacific, for instance, is leading the pack. We're talking a KGR of just over 7%, 7.097% to be precise.
Wow, over 7%?
Yeah. Their market size, it's projected to more than double. It was around $518 million in 2021. And it's expected to hit over $1.16 billion by 2033.
That's huge expansion.
It is. And within Asia-Pacific, you've got key players like China. Their market's projected to hit over $330 million by 2033, up from about $157 million in 2021. Japan's also showing really significant growth, looking at over $257 million by 2033, starting from about $122 million.
So major economies driving a lot of that value.
Definitely.
Yeah.
But maybe the real headline in Asia-Pacific is India. It's flagged as one of the fastest growing markets in the region. Get this,
Yep.
An 8.1% CAGR, almost 8.12% actually.
8.1%, okay.
Their market is forecast to jump from roughly $80 million in 2021 to over $200 million by 2033. And you also see remarkable growth in places like Singapore, 8.6% CAGR, going from about $18 million to over $46 million. And Southeast Asia as a whole looking at an 8.3% CAGR, moving from about $51 million to $126 million. Just, really rapid acceleration there.
It really is remarkable. And that kind of aggressive growth, especially seeing numbers like India's 8.1%, it suggests something more than just buying vaccines. It likely points towards a deliberate investment in domestic manufacturing capabilities, too.
Ah, interesting point. Self-sufficiency.
Exactly. After, the lessons from recent health crises, many countries are prioritizing being able to produce vaccines themselves. These numbers, particularly in Asia-Pacific, they seem to strongly reflect that strategic shift, securing future supply chains.
Makes sense. Okay, let's shift continents. Africa. This region is actually the fastest growing overall. The CAGR, over 10%, 10.113%.
10%, that's phenomenal.
Isn't it? It means the market size is projected to nearly triple. It starts smaller, sure, just $24.6 million in 2021, but it's expected to reach over $73 million by 2033.
Wow.
And specific countries show this trend clearly. Nigeria, for example, projected to go from $5 million to over $14 million. That's almost a 10% CAGR right there.
Yeah.
South Africa, too, from about $9 million to over $26 million. Again, nearly 10% CAGR. The pace of growth is just, it's striking, especially given where they started.
Absolutely. Off a lower base, but that rate is significant.
And rounding out these high-growth areas, let's look at South America. also showing really strong momentum.
Yeah.
Their CAGR is 7.786%. Let's call it 7.8%.
So very strong.
Definitely. The region's market is set to more than double as well, going from about $84 million in 2021 to over $200 million by 2033. Brazil's leading the way there, projected to hit over $62 million from about $27 million. And you also see Argentina and Colombia posting really robust growth. Both have CAGRs over 8.5%. Argentina's at 8.54% and Colombia at 8.51%.
You know, when we see these consistently high growth rates, over 7, 8, even 10% in developing regions like Africa, parts of Asia Pacific, South America, it really makes you ask what's driving this beyond just general economic uplift.
Right. What are the specific factors?
Well, it likely signifies a critical mix of things. Increased investment, certainly, maybe in basic public health infrastructure. Also, a much heightened awareness of pandemic risks, post-COVID, that's huge. And potentially more agile regulatory environments, helping to fast-track vaccine access in some of these places.
So a combination of need, awareness, and maybe supportive policy.
I think so. For these regions, it feels less like just treating disease and more about building that foundational health resilience. Preparedness is becoming like a top-tier national security issue, and you see it in these growth rates.
Okay, that makes a lot of sense. Now let's pivot a bit. Let's talk about the major established markets. Places like North America and Europe. Their growth might look steadier, maybe less explosive, but they still represent enormous value, right? They're the bedrock of the global market.
Absolutely. Huge existing market.
So North America, its market size was over $373 million back in 2021. It's set to grow to about $480 million by 2025, and then anticipated to hit over $768 million by 2033. The CGR there is just over 6%, so 6.03%.
Yeah.
Very respectable growth.
It's a solid, yeah.
And if you break it down, the U.S. accounted for the lion's share, over $293 million in 2021. That's projected to reach over $590 million by 2033, growing at about 5.8%. Interestingly, Canada actually shows the highest growth rate within North America, almost 7% CGR, 6.955% to be exact, set to grow from about $44 million to over $98 million.
Oh, that's interesting about Canada.
Yeah. And Mexico's also solid, growing at about 6.5% CAGR, projected to move from $36.5 million to nearly $79 million.
Right.
Forecast is for that to rise to over $313 million in 2025, and then over $504 million by 2033. The CGR for Europe overall is 6.14%.
So pretty similar to North America's overall rate.
Very similar. Now, looking at key countries within Europe, France actually stands out, has the highest key AGR in the EU at over 7.2%.
Really? Higher than Canada even?
Yeah, 7.29%. Projected to grow from about $31.7 million to over $72 million. Italy's also strong, about 6.7% CAGR. Then you have Russia, Germany, the UK, Spain, all showing steady growth, kind of in that 5.1% to 5.5% range. But what's also quite interesting is the rest of Europe category, often smaller or emerging players within the continent. That segment shows really robust growth at 7.65% CAGR. So even within established Europe, there's some dynamic growth happening outside the biggest economies.
That suggests broadening access or maybe new national programs kicking in across more European countries?
Could be. And finally, let's touch on the Middle East. This market is characterized more by moderate but still consistent growth. The CDR here is 4.466%, let's say 4.5%. It's set to grow from about $52 million in 2021, $51.853 million to over $92 million by 2033. Key contributors mentioned are Saudi Arabia, starting at over $17.6 million in 2021, the UAE at $4.8 million, and Egypt at $4.4 million.
Right. So if we try to connect these established markets, North America, Europe, the Middle East, back to that bigger picture, the differences in growth rates compared to the emerging regions are quite telling, aren't they?
How so? What does that difference suggest to you?
Well, for regions like North America and Europe, that steady, solid growth, say 5-7%, it likely points towards sustained investment in existing public health programs. You have consistent regulatory frameworks, established vaccine schedules, maybe development of next-gen vaccines for evolving strains, but it's building on a strong base.
So optimization rather than rapid expansion.
Exactly. The growth here isn't primarily about reaching vast new populations like we might see elsewhere. It's more about maintaining and improving within an already robust system, perhaps introducing booster programs, updating formulations, that sort of thing. It's a mature market dynamic. It contrasts quite sharply with that more foundational, rapid build-out we're seeing in parts of Africa, Asia, and South America.
Okay, that distinction is really clear. So wrapping this up, what does this all mean for you, our listener?
Well, we've definitely seen a clear picture of strong global growth in this H7N9 vaccine market. It's undeniable. You've got these really significant expansions, particularly in Asia Pacific, Africa, and South America, showing that rapid acceleration. But you've also got that steady foundational growth continuing in the established regions like North America and Europe. It's a truly dynamic global landscape.
And I think the takeaway is that this market's very promising future seems really tied to how healthcare systems keep evolving around the world. It depends on those regulatory frameworks getting stronger, and crucially on that sustained commitment to global pandemic preparedness programs. Understanding these market dynamics, well, it gives you a much clearer view of where global health priorities are heading. Knowledge is useful, but applied knowledge is powerful.
Absolutely. So to leave you with something to think about, given these projections, this incredible growth, especially in certain regions, what emerging health challenges or maybe even investment opportunities do you think might be uniquely linked to this evolution in a specific vaccine market like H7N9? And maybe more broadly, how might these shifting market dynamics, this blend of rapid growth and steady investment, actually shape global health policy over the next decade? Something to mull over.
Welcome to the Deep Dive. Today, we're tackling something that's definitely been capturing attention globally. We're talking about avian influenza, specifically the H7N9 strain, and how it's starting to directly affect human health. Big concerns there. So, our focus is going to be on the H7N9 vaccines market. It's a really dynamic area. Our mission, really, is to give you a clear shortcut to understanding what's happening, the key drivers, the roadblocks and the interesting trends popping up. And we're basing this deep dive on a close look at excerpts from H7N9 Vaccine Market, Drivers, Challenges, and Trends from Cognitive Market Research. We'll pull out the important bits for you. I'm really keen to unpack how these outbreaks are, well, shifting priorities globally and this urgent need for vaccine readiness.
Yeah, it's a fascinating market and honestly vital to understand. It's complex, no doubt, but the implications for global health security are huge and things are moving fast.
Okay, so let's dive right in. What's really pushing this market forward? You mentioned the stakes are global.
They absolutely are. I mean, the biggest driver is just the sheer global concern about these H7N9 outbreaks cropping up in humans. It's gotten everyone's attention.
So governments and health organizations are reacting.
Definitely. They're actively putting serious resources into pandemic preparedness now. We're talking specific funds, planning.
For things like stockpiling?
Exactly. Stockpiling vaccines, figuring out rapid deployment strategies. It's all about protecting populations, trying to get ahead of it,
Right. That makes sense. And you mentioned strong governmental support. It's not just the threat, but the response, like you said. What about major players like the WHO or the CDC?
Oh, their role is critical. It's not just handing out research grants, though that's part of it.
Okay.
They're actively working to streamline the regulatory side of things, speeding up the pathways to get vaccines approved and produced.
Which directly helps get them made faster, especially where they're needed most.
Precisely. In those high-risk regions, cutting down that time is absolutely crucial for containment.
Okay, so policy and funding are key. But what about the science? Are there technological breakthroughs making a difference here?
Yes, and this is where it gets really exciting, actually. We're seeing major advances. Think mRNA vaccine platforms.
Like we saw with COVID.
Exactly like that. Also, recombinant production methods are getting much better, and we're developing more advanced adjuvant systems.
Can you unpack those a bit? Adjuvants?
Sure. Adjuvants are essentially boosters added to vaccines. They help kickstart a stronger immune response from the body, makes the vaccine more potent, potentially means you need less of it.
Okay. And mRNA and recombinant.
Well, mRNA lets us use a genetic message to tell our cells how to make a piece of the virus, prompting immunity without needing the whole virus. Super fast to adapt. Recombinant tech involves making just specific viral proteins in the lab. Both are much quicker and more flexible than older methods.
So faster development, more efficient production. Sounds really promising.
It is. These innovations are genuinely changing how quickly we can develop and scale up vaccine production and distribution.
But I imagine it's not all straightforward. No complex area like this without hurdles, right? What are the challenges holding things back?
You're absolutely right. It's definitely not smooth sailing. The biggest challenge, fundamentally, is the H7N9 virus itself. It's just unpredictable.
Unpredictable how?
Well, its transmission rates can vary wildly. Sometimes it jumps easily, sometimes not. And crucially, it has high mutation variability.
Meaning it changes easily.
Constantly. Those surface proteins, the H and the N, they shift. It's like trying to develop a key for a lock that keeps changing its tumblers.
Right. So what does that constant change, that unpredictability mean for, say, a company trying to make a vaccine for commercial viability?
It creates huge uncertainty. It's really hard for developers to invest potentially hundreds of millions when they don't know if the strain they're targeting will even be the dominant one next year or if an outbreak will sustain demand.
So it deters private investment.
Significantly. Especially when the intensity of outbreaks goes up and down, it makes forecasting almost impossible, which isn't great for business planning.
Okay, so the virus itself is a moving target. What about the actual process of making the vaccine? The practical side, cost, regulations.
That's the other major hurdle. It is incredibly costly and complex. You need strain-specific research, which takes time. Then you have extensive clinical trials, phase 1, 2, 3.
Years, right?
Years, and a massive financial commitment. We're talking huge sums of money. It's particularly tough for smaller biotech firms. They might have great ideas, but sustaining that kind of investment is often beyond them.
And let's say you overcome all that. You have a successful vaccine. Getting it out there.
Yeah.
There's another challenge, isn't there? The logistics.
Ah, yes, the cold chain. This is a classic problem in vaccinology, but still very relevant.
Explain that.
Many vaccines, potentially including some H7N9 candidates, need constant refrigeration, from the factory, during transport, right up until it's administered. Maintaining that cold chain perfectly.
It is hard.
It's incredibly difficult, especially in low-income countries or rural areas that might lack reliable electricity or refrigerated transport infrastructure.
Which means the people who might be most at risk in some areas could have the hardest time getting access.
Exactly. It seriously limits reach and equity.
Okay, so significant challenges. Virus unpredictability, cost, complexity, logistics. But despite all that, you mentioned innovation is still happening. What are the key trends driving things forward? What's giving hope?
There is definitely forward momentum, yes. One of the biggest trends, and potentially most impactful, is the push towards a universal influenza vaccine.
Universal,
Meaning a single vaccine that could protect against many different flu strains simultaneously, including novel ones like H7N9 and maybe even future pandemic strains.
Wow. That would be a game changer.
Absolutely. If successful, it could drastically reduce the need for constantly updating strain-specific vaccines. It would fundamentally change global flu preparedness. A huge shift.
That sounds incredible. What else is trending?
We're seeing a definite rise in collaboration, particularly governments forging stronger public-private partnerships.
Working directly with the vaccine makers.
Yes. Going beyond just funding research, they're making agreements, pre-ordering potential vaccine doses, building up stockpiles before a major outbreak hits.
So that ensures faster availability if needed. The doses are already secured, essentially.
Precisely. It guarantees a certain level of supply is ready to go, which is critical for rapid response.
Okay, universal vaccines, more partnerships.
Yeah.
Anything else?
Yes, a really important one. A growing alignment with One Health initiatives.
One Health. What does that entail?
It's a holistic approach. It explicitly recognizes that human health, animal health, and the health of the environment are all deeply interconnected. You can't really address one without considering the others.
Right. So connecting this back to H7N9, which comes from birds, how does this One Health approach help practically?
It's foundational for prevention. By systematically monitoring avian populations, tracking virus circulation in animals, even developing vaccines that might work across species, you create an early warning system.
Catching potential spillovers before they happen.
Yeah. Exactly. It's about preventing these zoonotic diseases, the ones that jump from animals to humans at the source. It really underlines that protecting human health means protecting animal health and the environment, too. It's all linked.
So quite a journey we've taken today through the H7N9 vaccine market. We've looked at the big drivers, the global concern, the governmental push, the tech advances. We've also acknowledged the real challenges, the tricky nature of the virus, the costs, the cold chain issues.
Definitely significant hurdles.
And we've explored those key trends, offering hope that push for a universal vaccine, the collaborations, and this vital One Health perspective. Hopefully this deep dive has given you some crucial insights into this really important area.
So thinking about everything we've discussed, particularly those lessons from H7N9 and this push for One Health, it makes you wonder, doesn't it? What unexpected animal populations or maybe even environmental changes could be the next early warning signs for human health threats? And maybe more importantly, how do we as a global community even start looking for them effectively? Something to consider.